Well, it's now time for our regular health checkup. And today we are turning our attention to women's health and the conditions that are often underdiagnosed or falling behind in medical research. Joining us to talk through some of the issues is doctor and women's health advocate Linny Fong. Linny, if you want to get me fired up, it's this topic.
Let's do this.
Okay, so first up, when we say women's health is falling behind, what exactly do we mean by that?
Yeah, so I think simply put, we know that women unfortunately are misdiagnosed, are underdiagnosed, and often will be diagnosed later just because the biases that exist in, I guess, healthcare. So, you know, our perfect example of that is endometriosis. There's been stories at the moment, so 1 in 9 women have endometriosis, and yet it takes an average 6 to 8 years for a diagnosis. What we hear from women is that they're often dismissed, that they're told that they're just anxious, or it's just part of being a woman, that, you know, they're the symptoms that are being presented. The other thing that we know is that research is quite behind. Women are often not enrolled in research for various different reasons, and so, you know, if the research is falling behind, then obviously our healthcare is going to not be on par as the males.
Can diseases and certain conditions present differently in men and women?
Yeah, absolutely. So the classic example is heart attacks. And so we've seen in women that heart attacks don't present in the same way as the textbook classic crushing chest pain in heart attacks in men. Women often present instead with fatigue. They might feel short of breath. They might have a bit of back pain. And so if you're not sort of thinking about it, then it can be missed, and therefore, again, you know, poorer outcomes in women. So that's quite unfortunate. But also we see in, you know, some of the neurodivergent diagnoses as well. So autism, even depression and anxiety can be diagnosed due to different symptoms. And so, again, you know, we just kind of need to be more on the lookout for that.
When we talk about certain diseases, like breast cancer, for instance, cervical cancer, I mean, a lot of people say we have made huge strides in those areas. But is funding and research part of the problem, or what's going on here?
Well, funding research is very important to be able to make sure that we have the evidence to do what we do in terms of clinical guidelines and in treatment and management. We know in Australia that there is a national women's health strategy which exists, but certainly what we know is that funding from federal government, only 3% of funding goes towards women's health conditions, and most of this is actually in women's reproductive and, you know, fertility care and sexual care. So this is only one part of a woman's lifespan. So what we need to do is we need to aim for sort of broader research across the lifespan of a woman's health. So I think that's really quite important.
Yeah.
Why are some groups of women more affected than others in this?
Yeah, I think this is kind of a health equity issue. And so with health equity, when there are factors that obviously are barriers, then these are all compounded. So people from First Nations background, people who are in regional and rural centres, people who are, you know, from non-English speaking backgrounds, they are all at a further disadvantage, and so this all kind of just adds up and compounds everything.
If we want to make meaningful change when it comes to women's health, what would that actually look like?
Yeah, so going back to that National Women's Health Strategy, certainly what we want is that there is greater sort of research into conditions that disproportionately affect women. We also want there to be better access, but I think what we've heard recently in the media is there needs to be better listening. Like, we need to really listen to what people's experiences are, women's experiences through healthcare, and we need to be able to ensure that people are able to I guess, get the treatment that they need when they need it. So I think there's still a long way to go, unfortunately. Hopefully we are taking more and more positive steps. But yeah, certainly International Women's Day, I think, has been a reminder of that.
Yes, absolutely, which was celebrated yesterday. So, Linny, thank you very much.
Pleasure. Thank you.
Thanks, Lenny.